Mhm. Hello, can you hear me?
Hi, Max. We all can hear you. Can you please help me start my video?
Great. I'm sharing my screen. We make you into a host then. Okay, should be good now.
Okay. Fine. So, hello, everybody. It's so nice to see you all here for this webinar. And it's just lovely to see more than 100 participants right now and be here on a Thursday evening and gain some knowledge on the topic of polycystic ovarian syndrome, which is something which a lot of people wanted to gain knowledge on. And it's our pleasure and it's an honor to be here with Max and present to you some points about PCOS, which will definitely be very, very helpful to all of you. I would really request everyone to get a small notebook and get a small pen and just make your little notes if you want to remember whatever we tell you to, or you can even take some screenshots. This video will also be there on YouTube. So if you ever want to refer to it again, you can go on to our YouTube channel, that is Berkowitz Hair and Skin Clinic, and you can see the video again. So please ask your questions. Ask as many questions as you can. We are going to make the presentation and keep the presentation short and try to answer as many questions. So over to you, Max.
Thank you, Anupia, for the intro. My name is Max Kushner. I'm a biologist by training, and I'm the Chief Science Officer at a precision nutrition startup called Sova Health. And I just wanted to mention that you could see this presentation live on our Facebook page.
We can't see you. We can't see you.
You cannot see me. Well, I will, let me try and see if I can. Is it a camera issue? Yes, okay, fine. Just one moment, please. Okay, so my video is not starting now, so we can just continue with the presentation.
Awesome.
And once presentation is done, we'll sort it out. Okay, so what is PCOS? PCOS is an endocrine disorder, which means we're dealing with unbalanced hormones with an incidence of 5 to 10% in the world in women of reproductive age. In India, the current literature states it to be a bit higher. Between 10 and 50% of women within reproductive age in India are affected by this condition. It's a chronic condition, which means there is no cure for it, but it can be managed. It can be managed with lifestyle changes, with medication and cosmetic treatments for some of its symptoms. We'll go over that in detail in our presentation. And this, since this is a disorder of the reproductive system, the symptoms usually subside by menopause. And just in contrast to popular belief, PCOS is a disorder that actually involves many organs, not just the ovaries, because PCOS, as opposed to PCOD, PCOS is an endocrine disorder, is a disorder of a hormonal nature, and there are many hormone secreting organs and that affect this disease in terms of hormones and metabolism, and we'll go deeper into that. While PCOD is a condition that is much narrower, and I guess Anupriya will mention.
Max, can you speak louder, please? We have some feedback that your volume or your audio is not very audible.
Sure, no problem. I'll just hold on to my mic. Yes.
All right.
To you, Anupriya.
Is the screen view the same as before? Because there's a little, yeah.
Did we lose the presentation?
Yeah, now it's fine. I think, it's crossing the, oh, wait.
Yeah, this is fine, Max. It's okay.
Okay.
So what are the various symptoms of PCOS? The most common symptoms of PCOS are due to your ovulatory dysfunction, which includes amenorrhea or oligomenorrhea. What is amenorrhea or oligomenorrhea? That is irregular periods. And there are various symptoms of androgen excess also with which patients come to me with their concerns. That includes hirsutism. Hirsutism is increased thickness of your hair, especially on your face, acne, alopecia or hair loss, and even other symptoms like skin tags, stria or stretch marks, and even weight gain. There are various symptoms of insulin resistance as well. That includes acanthosis nigricans. That is, there is hyperpigmented, thickened texture of your skin, which can be there on your neck and on your underarms, which I'll be discussing in detail later, and even obesity. Next slide, please.
So there's some symptoms of PCOS that are actually not very specific. So from anything from mood swings to tiredness, to insomnia, to headaches, of course, food cravings, and we will actually dive deeper because into those symptoms also during the presentation, because having PCOS could actually explain some of them.
So how do you diagnose PCOS? This is something which is extremely, extremely important. There was a criteria which was put down by Rotterdam in 2003. And there are 3 major symptoms which are used to diagnose PCOS. However, even if 2 of them are positive in you, then you are set to have PCOS. What are these symptoms? First is the irregular periods. Now, these periods, what is irregular periods? Irregular periods mean that you have less than 8 menstrual periods in a 12-month year. Also, when one cycle lasts for more than 45 days, or when you have amenorrhea or no menses for 3 consecutive months in 1 year. So you have to remember these things, that if you have irregular periods, or if you have symptoms of increased male hormones, that is, if you have very, very oily skin, if you have acne, if you have hair loss, if you have hirsutism, or if you have acanthosis nigricans, if you have, skin tags on your skin, if you have stretch marks, all these symptoms come under increased androgen symptoms. And or if you have polycystic ovaries, which can be diagnosed by a transvaginal sonography. And through transvaginal sonography, we see that if you have more than 12 cysts in each ovary, measuring 2 to 9 mm in diameter, and or if you have more than 10 ml volume of each ovary. So all these symptoms are first taken into account and they are seen by your doctor, and then only are diagnosed as PCOS. Now, how do you give your blood sample when you have PCOS? This is also very, very important. You have to give an overnight fasting sample, and you have to give it on the 2nd day of your periods. When this sample is collected, then we measure the various battery of hormones, which includes LH, FSH, testosterone, prolactin, and then we diagnose whether you have PCOS or not. This also includes clinical evaluation of the patient. Next slide, please. So what are the various dermatological manifestations of PCOS, or how does PCOS affect your skin and your hair? Now, when it affects your skin, a patient can present with hirsutism. As you all know, thickened hair on your skin, thickened hair and very terminal and coarse hair on your skin. Next is acne, which can present as blackheads, whiteheads, small bumps on your skin, that is papules, or even pustule lesions. Even cystic acne can be seen in PCOS. Hair loss is something which is very, very common in PCOS patients, and it leads to thinning of your hair or miniaturization of your hair and widening of your hairline. And also acanthosis nigricans, as I told before, that this is hyperpigmentation and thickening of your skin, and it can present on your neck folds, below your breasts, and even your underarm area. Acanthosis nigricans can be treated by medical therapy and by clinical therapy also, which I'll be discussing later. And the other symptoms are stria or stretch marks and even skin tags. Next slide, please.
So just to have a brief overview of the mechanism of disease, of the pathophysiology of PCOS, we have this slide here now that depicts all the different body systems that are involved in this condition. what I want to mention that is there is a genetic predisposition for contracting PCOS. There are studies who show that children of mothers that are suffering from PCOS have a tendency to have higher androgen levels. Now, those are both male and female children. So PCOS is basically a mix of genetics, environment, and lifestyle choices that can not only determine whether the disease is going to actually onset, but also determine the progression and the severity of the symptoms of this disease. And to just understand the mechanisms a bit better, I made some simplified examples that I can share with you. So one of the things that are very common to see in PCOS is insulin resistance. Insulin resistance is actually a condition where our cells are desensitized to the signaling of insulin. Insulin is a hormone that is needed in our body. It's secreted in response to having glucose in our blood. So basically what happens every time we eat, our food is breaking down in the stomach. It crosses the stomach lining into the blood vessels, and glucose arrives to the blood. Now, having too much glucose in the blood is not a desired thing, because glucose tends to react with proteins and other components of our cells and cause damage over time. So the body wants to basically get rid of that glucose and put it in the cell as quickly as possible. For that, it secretes insulin. So insulin would go, depicted as the key here. I hope my screen is not over obstructed. It would tie up to the insulin receptor, and it would enable glucose to go from the blood and into the cells. Now, when we have insulin resistance, it means that the cell is able to sense the insulin, but it's not responding, and much more insulin required to initiate the same response in a healthy cell. And this is why we have accumulation both of insulin and glucose in our bloodstream, which leads to weight gain and also to some skin symptoms, as Anupriya mentioned before. Now, what it also does, it makes androgens build up in our bloodstream, and those androgens go and intervene. Androgens are male hormones. They go and then intervene with the ovulatory process that are happening. That's why you get the irregular menstruation and other reproductive symptoms. Our hair follicles are also very sensitive to androgen levels, and this is why you would get acne and hirsutism and even male pattern hair loss, alopecia, from having high androgen levels in females. Now, what happens for ovulation, that in women with PCOS, there are two hormones that basically govern the menstruational cycle. One is LH, or luteinizing hormone. This is a hormone that is basically promoting the creation of other hormones, androgens specifically, so male hormones. Male hormones, by the way, are present both in males and in females, and vice versa. Just the levels of expression of those hormones are determining different physiological processes in males and in females. So luteinizing hormone is responsible for making testosterone, basically. And follicle stimulating hormone, or FSH, is responsible for signaling the follicle to mature, produce an egg, and to ovulate. Now, as you can see on the graph to your left, this is a healthy cycle where FSH levels are a bit higher than LH levels starting the month. Then somewhere in the middle of the cycle, ovulation occurs. So there's a peak of LH over FSH, and this is the signal that our body needs in order to ovulate. Well, the female body in any case. And in PCOS patients, because there is too much testosterone, there's too much androgens, the level of LH, the baseline level of LH is higher, right? So the signal, this peak never occurs. And this is why eggs are not able to mature, and sometimes they remain in the ovary and create those cysts that we've mentioned earlier. And this is exactly to show you the link between the nutrition and the ovulation cycle of the menstruation. So the more unbalanced sugar that you would have in your blood, right, the more androgens you would produce, and those androgens would actually have an effect over the LH and FSH levels, which would actually cause this irregular menstruation. So you can start now to understand the role that nutrition plays in managing this condition.
So, coming to the treatments of PCOS, as we all know that there is no permanent cure for PCOS. as the cause still remains unknown, but we can cure the symptoms of PCOS and we can try to eliminate these symptoms. Even losing 5% of weight decreases PCOS symptoms, let me tell you all. So what we need to know is that we need to work on our lifestyle. We need to work on the systemic treatment and the medical treatment of particular symptoms. And there has to be a synchronized effort between a dermatologist, nutritionist, endocrinologist, gynecologist, and even a physical trainer who's helping you lose some weight. Next slide, please. So coming to the most common symptom associated with PCOS is acne. And a lot of patients come to me with acne in case of PCOS. And that is the first thing I tell all my patients is that if you have increase in weight or if you don't have healthy eating habits and if you have acne, then you must have some lifestyle modification. So other than the various medical treatments that can be done for acne, which includes oral and topical antibiotics, various chemical treatments can also be done at the clinic to give you faster results. And that includes chemical peels, and various chemical peels like salicylic peel, salimandelic peel can be done to reduce your acne and even to reduce your acne associated pigmentation on your skin. Laser treatment like intense pulse light treatment can also be given to treat your acne faster. Now, a lot of people have a habit of picking their acne, which causes acne scars. And that is why if you have seen my videos on acne, you would know that I always tell you all not to pick up your acne if you have acne associated with PCOS or not associated with PCOS. This will lead to acne scars, which cannot be treated by any medical treatment, and you will require an intervention by a doctor. And there are various procedures that can be done at the clinic for treating your acne scars, which includes derma roller, laser treatment, and even chemical peel. So other than acne vulgaris, there are other conditions like acanthosis nigricans, which is thickened velvety skin on your underarms, on your neck, and even in below your breasts and your antecubital fossa or in your arms. And this can be treated by medical therapy. That is, if you go to a doctor, you will be prescribed certain creams containing kojic acid, AHAs, glycolic acid, arbutin. And other than that, chemical peel treatment and Q-switch NDR laser treatment can be done to decrease your pigmentation and to improve the texture of your skin. And this works wonderfully. However, please keep in mind that acanthosis nigricans cannot be treated completely. The symptoms decrease. And it's not just the topical treatment that helps, but you also have to keep in mind that lifestyle modification is very, very important. Please, next slide, please. So this is a patient who took a video consultation with me, and you can see that within a month's time, just with medical therapy, there was a huge difference in the pigmentation on the neck. And this can be further improved by in-clinic treatment with the help of chemical peels and laser. Next slide, please. So coming to hair loss, and with hair loss, there comes a lot of stress. A lot of patients come to me with thinning of hair and widening of their hairline associated with PCOS, and not just medical therapy, but various therapies at the clinic give wonderful, wonderful results. Medical therapy includes using oral supplements containing biotin, zinc, and various other multivitamins. And the topical solution that you have to apply includes minoxidil, which is FDA approved, and also Procapil and Capixil for the treatment of hair loss. Now, along with this, if you get treatments done at the clinic with the help of laser, with the help of derma roller, and even PRP, next slide, please, there can be wonderful, wonderful results. You can see that there's a picture before after where this patient suffered from PCOS, and she was just 23 years old, and you can see that how significantly her hair had decreased in the before picture. And just within a month's time, we did an autologous micrograph treatment for her. You can see the amount of result that she got within a month's time. And this keeps on improving over the second month, over the third month. So the Berkowitz has been a pioneer in treating hair loss and especially with autologous micrograph treatment, because Berkowitz is the only clinic in the world to treat more than 300 patients with this treatment. And we have got some wonderful results with this treatment, especially in PCOS patients. I would highly, highly recommend it. Other than AMT, we have bio-PRP treatments, which is a notch higher than PRP. As you all know, a lot of people must be knowing about PRP. For the ones who do not know, PRP is called platelet-rich plasma. In this procedure, we take some blood from a patient, separate the plasma, and we inject it on the scalp. And this helps in increased growth factor supply to your hair follicles, which helps in increased growth of your hair. And bio-PRP is a notch higher than PRP. There are more growth factors and more platelet activating factors, which help in growth of your hair. Next slide, please.
Yes. Now I would like to discuss some of the biomarkers that are really important for managing PCOS. So here I would focus on the test that we would like to do in order to manage the condition rather than to diagnose it. So as Anupriya mentioned, vitamins, especially the B complex vitamins, biotin, vitamin B12, are very important for both managing the symptoms of PCOS, because these vitamins are involved in converting sugar into energy, making the relevant hormones, and also to tissues that are renewing quickly. And hair follicles, for example, is a tissue that renews quickly and is very sensitive to different changes. Then when these vitamins are in a deficiency, people with PCOS tend to have much more drastic results than people who do not. Also, we would like to monitor blood sugar markers, of course, because women suffering from PCOS tend to have a much higher risk of type 2 diabetes. This is something that we want to monitor and keep a close eye on and intervene if necessary. Thyroid hormones. The thyroid is an organ that controls our metabolism, the speed of which we metabolize things. So basically, it sets the difference between am I storing energy now as fat or am I burning energy now? And the thyroid is linked because it participates in the metabolic cycle that we're having. Of course, is linked to this disorder. Other hormones that we want to monitor are testosterone and cortisol. Cortisol is a stress hormone that can have profound effects on women with PCOS. And of course, the blood lipids, so the cholesterols and the triglycerides that are need to be kept at bay for these people not to suffer a risk for metabolic syndrome and liver disease. Now, when we talk about diet for PCOS, we're basically talking about a diet that does two things. It controls weight and it controls blood sugar. Both weight and blood sugar, as I explained before, about the link between our hormones and our metabolism. It's a closed loop. So what we eat actually affects the hormone and metabolism, and the hormones and metabolism usually affect what we want to eat, right? So if we want to intervene in this cycle, food is the most actionable, or diet is the most actionable way to do it. So when we're talking about the diet for PCOS, we're talking about foods that have a low glycemic index, which is basically foods that don't create a burden of sugar in the blood when they are consumed. We're talking about lean or vegetarian protein for the same reason. It digests slowly, it gives us a feeling of satiety, so we're not feeling hungry, and also whatever is consumed with the protein is actually absorbed slower, and this is something that is desirable. Unsaturated fats to lower inflammation. Inflammation promotes PCOS, and we want to control that at bay. Fiber for the same reason, and also to control blood sugar. Vitamins, as Anupriya and I mentioned before. But what actually is very curious is that eating on time has been found by scientists to actually be as important as what you're eating, because eating on time and small meals during the day actually found to balance blood sugar over a prolonged period of time and prevent the surges in insulin that usually follow the surge in blood sugar. Same as for exercise. Some superfoods, I wanted just to give you a little tip. So the more vegetables you can consume, the better. Legumes and seeds can be consumed for the good fat content, same as for fatty fish. And if you can have one nutritional takeaway from this lecture, start consuming 1 tablespoon of apple cider vinegar every day. It's been proven by science to reduce blood sugar and cravings. This is very important for PCOS patients, as mentioned. Now, in terms of food you want to avoid, so processed foods, sorry, Maggie lovers, because of their high simple carbohydrate and saturated fats or trans fat content. Milk products should be consumed in moderation. Now, milk and milk products are actually usually full of nutrients and good protein, but if you consume industrial milk, the cows that are producing the milk are usually getting injections of hormones that can interfere with the hormone of the patient. So milk, if you consume organic milk, that would be much more advisable since those cows are not getting injected. And also in milk products, usually paneer or fatty cheeses contain less hormones and they're quite safer to consume. Soy is something that you want to eat in moderation as well because it contains phytoestrogens. So it's basically a molecule that looks like estrogen, and some of the bodies would sometimes recognize it as estrogen, and it could modulate the level of estrogen that is produced in those women. It could lower them, and that is an undesirable effect for PCOS because you have too much testosterone as it is, and it's balanced out with estrogens and other female hormones. And finally, refined flour, fried food, samosas, sorry, is not a good idea because it raises blood sugar significantly. And as I've explained before, blood sugar has profound effects on our hormones. And here, as I want to tell you about the program we have at Sova Health. Sova Health is a precision nutrition company, and we help our users to really learn what it means to eat healthy for them and do it in a very evidence-based manner. And also, with the recommendations that we're giving are quite personalized. And let me just give you a short overview of how we do it. A usual program lasts 90 days. It starts by a sign up and a filming of short questionnaire, which would help us to determine which blood panel we want to give you. You get a home collection of a blood test, and then you go on a series of consultations where we basically learn profoundly about your habits and about the results of your blood test and your goal. And we give you personalized recommendations that are based on the food that you're already eating at home. So it's very rarely we would give somebody like a meal plan to follow because we find that that's not very effective. But what we do is that you basically have over WhatsApp a nutritionist that's available for you 24/7. We get to learn what you're already eating, and we give you extremely personalized recommendations, as I mentioned, by your blood test and by the food that you're already eating, so that you can learn what it means to eat healthy. You can use this code we've shared to get a little discount if you want to try us out.
So there are various treatments that are available at Berkowitz as well. As I mentioned, to all of you that autologous micrograph treatment is one treatment that Berkowitz is a pioneer in the same, and we are the only clinic who has done more than 300 treatments in the entire world. So this is a very, very effective treatment for hair loss. Laser hair reduction is something which is very effective for hirsutism, and we have painless laser hair reduction technology. So if you have hirsutism, take laser hair reduction without a second thought. It is really, really going to help you because there is no other treatment which helps in reducing your hair other than laser hair reduction. Other treatments include chemical peels, and this is very effective for your pigmentation and for post-acne pigmentation or acanthosis nigricans. And this helps in reducing your pigmentation much faster than the topical treatment. So I would highly recommend it that if you want to get your pigmentation treated faster, go for chemical peels and even laser treatment, which is extremely effective. Other very good treatment for hair loss is bio-PRP, which is, I told you that a notch higher gives better results than PRP because it has more growth factors, it gives more nutrition to your hair follicles, and hence it strengthens your hair more and increases your volume of hair in a much short span of time. So if you want to, if you have PCOS and if you have any of these symptoms, and if you want faster results, you must take some form of treatment. Next slide, please. And it's a good news for all the patients who have registered, for all the participants. I'm so sorry, I keep calling everyone patients. I'm so used to it. And you can use the code BERKPCOS and you can have a 50% off on video consultation. And you have to do it soon because the offer is valid only till tonight. Thank you, everybody.
Thank you very much.
And I think there are a lot of questions in the Q&A section, and some people were even raising their hands. So Arpit and Tanveer, if you could help us out.
Arpit, if you can just fix my video, please.
Yep, let me try and do that.
That time, what I'll do is that I will look into the questions that are posted in the chat, and I'll just answer them. So Parul has asked hirsutism solution. I hope, Parul, I've answered your question. I've already mentioned the solution for hirsutism, that is laser hair reduction. But if you want a medical treatment, then what you can also do is that you can probably get your hair, if you have increased hair growth on your face, then you can probably go for waxing, threading, and then use a cream which has eflornithine in it. And this helps in reducing your hair. But please remember that eflornithine does not lead to permanent removal of your hair. It reduces your hair and it decreases the thickness of your hair only till the time you keep using that cream. If you want permanent reduction of your hair, then go for laser hair reduction. It's a wonderful, wonderful treatment. All right. So there's Shreya asking how to deal with open pores. But so open pores can be seen in patients who have seborrhea or who have oily skin. And for open pores, you must make sure that you use products which decrease the oil in your skin. Use a face wash for oily skin. Use face masks which help in decreasing your oil in the skin. You can even go for chemical peels. And very, very good treatment for open pores is microdermabrasion treatment, which you can get it done at the clinic. It really helps in decreasing your open pores. One very important fact that I'll tell you is that if you use retinol containing creams, that also helps in decreasing your open pores. You can check out Berkowitz Renew Serum. It is a very good product, and that will help you decrease your open pores. All right.
So we have
yeah.
a lot of questions that we've collated, and so I think what we can do is that we can start with, I think you've already talked about the laser hair reduction, and a lot of people actually had that question, that what can they do for hirsutism and for excessive hair on the face. Another recurring question that I've noticed is, so a lot of them are talking about acne and acne scars, and there are some participants who are also interested to know if there are any solutions that are probably maybe on the natural lines, maybe Ayurvedic, maybe homeopathic, and is there any proof that any of them work?
Okay, so this is something, if you follow us on YouTube channel, I have really talked about this, that please do not self-medicate if you have acne. There, even though I have made a video on various home remedies that are available for acne, you can probably try one or two, but do not depend on them to treat your acne, especially if you have a higher grade of acne or if you have pus-filled lesions on your face. That is not the treatment which is formulated to get rid of your acne. There are medical treatments available and they are very, very effective. There are topical antibiotics and there are oral antibiotics, which are the first line of treatment to treat your acne. If that doesn't work, and if you want faster results, then there are treatments available at the clinic, which includes chemical peels along with the medical treatment. Now, if you have acne scars, there is no treatment, there is no home remedy, there is no medical oral therapy or a cream that can treat your acne scars. You have to get treatments done at the clinic, which includes derma roller treatment, which includes microdermabrasion, and which includes laser treatments, which are very, very effective. Erbium YAG is one of the most effective lasers, which is available at Berkowitz, and it really, really treats your acne scars effectively.
So just adding to that, we have a follow-on question, which is how to get rid of acne due to PCOS. Can lifestyle change and exercise cure PCOS without any medication? Is there a natural way to manage PCOS by intermittent fasting, active lifestyle, and by avoiding fast foods? Is this feasible? Max, can we have your views from the nutrition perspective?
Sure. Well, the answer is yes and no. PCOS is, as mentioned, is a chronic condition. So it's basically an imbalance in the way our body produces hormones that is there to stay. But, and anything that we do to disrupt this cycle further, like having bad lifestyle habits or having fast food, would disrupt it further and would cause outbursts both on the skin and also other symptoms of PCOS. Since we actually had patients in Sova coming to us, going on the program, and once we fix their eating habits, definitely you can see very good results with acne as well, because blood sugar now is stabilized. the androgens levels, the testosterone levels are lower, right? So the periods are more orderly, and also, of course, the skin condition is definitely improving. Now, that said, any patient is different. And some people have more severe forms of PCOS, some people have more mild ones. And the lifestyle modification is definitely, as Anupriya also mentioned, for the aesthetic symptoms, is one of the most effective things that you can do. But that said, I only actually doing it will tell you if you need other medications or not. In most cases, however, it helps greatly to reduce the symptoms and have just a normal life.
One of the other questions that I've observed a lot of people have asked is, I mean, one, I think this is sort of going back to the basics, but we do see this question quite a bit. What is the difference between PCOS and PCOD?
Yeah,
So I
so
think there's
Max talked about in the beginning of the session only that actually earlier it was called PCOD, the condition was called PCOD because it was thought to be only limited to the ovary. But now it's been seen that it is actually not just limited to the ovary, it is actually a multi-system disorder. It is a metabolic disorder, which not just includes ovary, but various other organs. Hence, it is called the polycystic ovarian syndrome and not just polycystic ovarian disease.
Yeah. Just to add to that, you could have PCOS without having cysts in your ovaries.
Yes, definitely, yes.
And yeah.
Okay, one question that's coming up again repeatedly is about dairy products, and do dairy and gluten-free products really help control PCOD?
Okay, so let me address the dairy first. So I think I've mentioned this on the talk itself as well. Dairy, when produced industrially, contains animal hormones within the dairy that our body, there's some controversial research, but that our body can recognize as our own. So basically think about it like that. In PCOS, there in any woman or man, there's a balance between male and female hormones. Now, when I start consuming something that looks like female hormones and it gets into my system may recognize it as female hormones and then decrease production, right? Because my body feels like, oh, you know, I'm making too much estrogen now. I should probably stop, even though this estrogen is inactive. So in that sense, dairy, I would try and consume either organic dairy, where cows are not being injected with those hormones. And also dairy products on their own tend to contain less hormones, especially the ones that have low fat. So that is actually probably okay. With regards to gluten, there are absolutely zero evidence that gluten induces symptoms of PCOS, unless people are sensitive or they have celiac disease, which is an autoimmune disease where the body recognizes gluten as an intruder and there's an inflammatory process starting. That said, a lot of the time, people who choose to avoid gluten, they experience a kind of a renaissance. They feel less and less symptoms of PCOS, but that is probably because they stopped eating bread, which is usually processed. And I mentioned refined flour has very high glycemic index. It raises blood sugar, it raises hormone levels, right? Which in turn affect the symptoms. So if you can have your carbohydrates in a complex form, you can have whole wheat, whole grains, millets, that would actually take you a long way in reducing your symptoms instead of saying, I'm going to avoid gluten and I'm going to cut out this whole group of foods out of my diet, which is potentially nutritious and good for me if consumed correctly, right? So there's a lot of education like that actually that goes on our program. And there's a lot of misconception around these things, and we are here to kind of clear it out.
You know, just for our viewers, and in fact, even I want to know, what are these brands which give organic milk? Because, you know, a lot of my patients also come to me and they ask me the same question.
So in India, there are several brands, which I can't recall right now, but there's also a lot of our patients, they have kind of desi relatives where they source the milk from. Tanvir, I think you had a good one where you
So
were
I
buying
can,
milk.
yeah, I can share a few options. There are now quite a few raw milk suppliers where they're not injecting antibiotics. These are, grass-fed cows, and these are now delivering directly to your doorstep.
Okay,
So,
so is not something that you would recommend.
sorry?
Mother dairy milk is not something that you would.
Amul milk is something that I would not recommend for PCOS. Yes, definitely.
Amul, Mother Dairy. So all of the commercial dairy farms are basically mixing cow milk with buffalo milk,
So,
and
I
these are
mean,
also commercially mass produced.
there is also a question that says, is there a difference between A2 milk and A1 milk? And is there research to show that one is better than the other for PCOS patients?
In terms of PCOS, both A1 and A2 milk usually contain hormones. It actually depends on the breed of cow that is producing the milk.
Okay.
In terms of nutrition value, there are some research that's saying that A2 is better than A1. As I said, this is negligible when compared to hormone versus no hormone.
Okay. We have a few questions uh, about the permanency of the treatment. I mean, how long will the treatment last, and is PCOS something that can be cured with lifestyle, or is it something that needs to be managed throughout one's life? What are
Hmm.
your thoughts on it? I mean, both Anupriya and Max. I mean, it would be great if you can sort of educate us on that.
Yeah, so as Max already mentioned that PCOS is a chronic disease, and even now there are questions about what is the cause behind PCOS. Other than the hormonal cause that we know, the cause still remains unknown. So there is no particular cure for PCOS, but we can manage the symptoms effectively. And for that, to all my patients who are who are a little overweight and obese and they have symptoms of PCOS, the first thing I tell them is lifestyle management. I prefer not to give them any medications if they can manage it with lifestyle. That is the most important thing. What do you think, Max?
Yeah, so I guess it's a combination of both, right? Some severe cases would probably require also medicinal treatment, and also for people to feel better with themselves as well. The appearance matters. I completely agree. And of course, when you try and accomplish lifestyle changes, it's better when you do it when you're mentally stronger.
Yes. Yes.
So I would definitely would not neglect the value of cosmetic treatments there, and not everything can be solved with nutrition, but PCOS as a condition, in very simple terms, it means that it's like a scale in our body, right, that controls our metabolism. If I put more food here, I will have more hormones here. If I put, better food here, I would have, a more balance. So my food is affecting my hormones, which in turn affect my metabolism, which in turn affects my food, right? Because if I'm having, for example, I'll give you a very simple example. People who eat a piece of candy, they have a surge of glucose in their blood, which is followed by a surge of insulin in their blood, which makes their cells to take up all the glucose, and then they feel hungry again. So this is the reason that most of us want to have a dessert after a large meal. It makes no sense, right? I just had this huge meal, and now I want something sweet. Why is that? Because I had a lot of calories, I had a lot of sugar go into me in that meal, probably, right? And then I get this drop, and this drop has a surge and a drop of insulin, which creates a surge and a drop in other hormones as well, right, as we've mentioned, which in turn affect my symptoms. And the fact that I'm starting to crave sugar again repeats this cycle over and over and over and over again during the day, which basically I'm giving myself more PCOS symptoms, right? With any person, it's true for any person, but with people for PCOS, the implications are stronger or harder, right? I'm giving myself acne, I'm giving myself more hair or less hair on the scalp. I'm giving myself this fatigue, right? I'm constantly fatigued and craving sugar. Why? Because I'm not eating right. Once you start eating right, people on our program after 10 days, after 2 weeks, they say, "Oh my God, I don't want sweets anymore. Oh my God, like I'm not tired anymore. I'm performing better at work. I'm sleeping better." And this is just because of how they eat. We didn't even took almost anything away from them, right? We just made some order into the chaos, and then that already has a result, and that already has a result for PCOS. But as a condition, this is something that needs to be followed lifelong, and this is why on my program I try and educate people to understand on their own after they graduate what is a good food for them and what is not so good food for them, so that they can, be educated and make those choices to gain those habits lifelong, rather than, go on a program, lose some weight, and then gain it back again because there's no habits gained, right? It was completely detached from what they were doing before. And for this reason, it's very, very rarely where we would give meal plans on the program. Rather that we'll do a lot of homework actually finding out what the user already doing or the patient, and then giving them interventions, little interventions, which we track week on week with a nutritionist, so that they can really learn good habits and implement them. And then managing PCOS becomes much more feasible.
Okay, great. I think that was really enlightening. Thank you for that. Um, again, I think just an extension of that question, Anupriya. I mean, a lot of them are also asking about how long will they have to undertake hair loss treatments? I mean, if they can manage their PCOS, will their hair loss stop? Will their hair regrow? And similarly for facial hair, I mean, if they can manage PCOS internally, will it also have external manifestations?
Now, what happens is that so you take a treatment for your hair, supposedly, and you get the results. Your hair becomes more thicker, and your volume has recovered. And suddenly, you gain your weight and your hormones become haywire. Then definitely your hair will start falling again. Again, you will start seeing symptoms of PCOS, whether it's acne, your hair fall, or even hirsutism. If you take a treatment, and after taking the treatment, when you've got the results, you're able to manage it with controlling your hormones, either with medications for the hormones or with lifestyle, and you're able to manage it consistently, your symptoms might not come back at all. Okay, because you've been managing your hormones, because you've been managing your entire system, which is causing the surge of hormones and the symptoms. So if you manage the cause, definitely the symptoms will not show. However, if you treat the symptom and you still do not manage the cause and you become lazy in that, you will definitely see the symptoms.
Yeah, just to add on what Anupriya said, it's a systemic disease. That's very wisely said. And it's something that is chronic, that's ongoing. So it has to be constantly managed, right? Does that mean you cannot have dessert anymore? No. Does that mean, you can do a bad choice sometimes or something that's unhealthy for you? Yes, it's fine, right? As long as the bigger picture remains okay. And the fact that people are obese or they have this excess weight around their abdomen specifically, on its own has an effect. It's not the cause, it is also the outcome, but it's also causing people to have higher risk of PCOS symptoms. And we haven't talked about the complications of PCOS, but there's much higher risks of persons suffering from PCOS to develop metabolic diseases like diabetes, like cardiovascular disease, like metabolic syndrome, liver disease. So because this system is shaky, right? Because it affects many organs. So there's definitely a huge medical motivation for persons who suffer from PCOS to start and learn what it means for them to have a healthy lifestyle and to maintain it going forward, right? Because if that's not going to happen, these people would most probably get sick, very sick. Yeah.
Okay, so we have a question from a user who says that I'm 22 years old and I have thyroid. What kind of schedule should I follow for my skin and my hair? I'm assuming here she means a lifestyle management schedule.
That's a combined question.
I think you can take it first, Max, and then I'll follow.
Yeah, so thyroid conditions, there are two kinds, which I don't know which one exactly does she have. And there's the hypothyroid, which means it's the underactive thyroid, and then there's a hyperthyroid, which means overactive. And the recommendations for the two would be very different. But let's assume usually what happens in PCOS is that the thyroid becomes actually underactive and the metabolism actually slows down. In that way, firstly, there would need to be a blood test to diagnose the condition. Secondly, then probably this condition needs to be taken care of with medication, because the thyroid is like the carburetor of the body in a way. It determines how fast are we burning our fuel, or are we storing calories now, or are we burning or exceeding them? So people with underactive thyroids tend to gain weight, and people with overactive thyroids tend to be very slim. And there are other complications that arise from that. But first you need to fix the thyroid, because the thyroid is also a component in the system. So once you fix the thyroid, either with medication and with lifestyle changes, certain things you cannot eat anymore, certain things you should eat more of, then this would in turn affect your blood glucose levels, which would in turn affect the androgen levels, as we've mentioned. And I would let Anupriya comment on the manifestations.
Yeah, so patients who have thyroid, usually, especially as was also told, that hypothyroidism is a more common manifestation of PCOS, and mostly patients who have PCOS come with the concern of hypothyroidism. Now, when they have hair loss, they need to go on the usual steps, to combat hair loss. That is to use medical treatment using solutions containing procapyl capixyl or minoxidil containing solutions, and to have some hair supplements which help, that is biotin containing supplements which help hair growth. And secondly, there are a lot of treatments which help in combating your hair fall if you have thyroid. Now, it is very, very important to take and to control your thyroid hormone level by taking medications or by lifestyle management when you're taking these treatments as well. Do not expect that if you take a treatment for your hair loss, it would completely cure your hair loss for life if your hormone levels are not managed well. So you have to manage your hormone levels with diet and with medications, and then take a treatment for hair loss. Second, about the skin, usually patients complain of dry skin and pigmentation on their skin when they have hypothyroidism. And this can be treated by moisturizing your skin well. And obviously, the pigmentation can be treated by certain topical creams containing AHAs, arbutin, or they can also be treated by chemical peel treatment. Yeah.
Yeah.
So what are the other questions there?
Great. So one of the questions, I think this lady has, she has good knowledge of what laser hair reduction is, and she's asking that how many sessions does a PCOS patient needs before they can see the same result as a normal someone who does not suffer from PCOS sees for laser hair reduction. So I think what she's trying to say is that we generally provide 6 to 8 sessions for someone without PCOS. How many sessions do we generally recommend for someone with PCOS, and what is the results that they can expect?
Okay. So, I had mentioned it during my presentation also that any patient who has PCOS does require minimum 10 to 15 sessions of laser hair reduction. And even after taking that, if your hormone levels are not controlled, you can have recurrence of hair growth on your face or on your body, and more so on your face. So you need to take maintenance sessions. But let me tell you, so this might sound a little cumbersome to take laser hair reduction sessions for 10 to 15 sessions, and even after that you have to take maintenance sessions. But maintenance sessions is probably 2 to 3 in a year's time. If you do not take laser hair reduction for hirsutism on your face, if you have PCOD, you would rather go for treatments like waxing, threading, or even bleach. But let me tell you, all these treatments make your face very sensitive, and they are not good for your skin in long run. So if you take laser hair reduction, that's the only best treatment which decreases the thickness of your hair, and it really leads to permanent reduction of your hair over a period of time.
Okay, I have a couple of combined questions here for you. Max, one, what is the best way to take apple cider vinegar? 2, will lemon water help me increase my strength and deal with fatigue after exercise? So I think we can do some myth busting here. And third, can you recommend a diet for PCOS?
Okay, so apple cider vinegar can be taken on an empty stomach in a glass of water, just 1 spoonful in the morning before food. If you don't like the taste, you can just start incorporating it into your food. So I know people are not very big on salads in India, but vinaigrette sauce, for example, which is basically olive oil, some mustard, and some apple cider vinegar, in that case, could really go a long way on making your vegetables taste better. And when consumed as part of a meal, that it has a good effect as well. So that's possible ways of consuming it. Also, we had a question about lemon water. So what happens about, the answer is no. No, it cannot. But what usually happens is that when people have workouts that are too intense, they burn out the glycogen stores they have in their cells, which is basically the available sugar that we have for like short bursts of energy. And this is why, to deal with fatigue in extra intense workouts, I would recommend to have a banana or a few almonds in the middle. So if you have an hour-long workout, just eat a banana in the middle of it or just before, if it's not too heavy. So that, and then that would really reduce fatigue, because the fatigue is caused by basically we have a way of storing glucose that's called glycogen, and it's making it available in the cells for when we need energy quickly. And that's especially if you work out in the morning, the stores are already depleted from the night fast, right? Because the body is using this energy for housekeeping, for breathing, making the heart beat. But during an exercise, you burn that further. So just have some food that's not heavy. So that's that. And then, can I recommend the diet for PCOS? Yes, definitely. We have programs for that. Please go to our website. It's Sova.health. And we even get a little discount with the code that we posted further. I guess Parak or Tanvir, you can post this on the chat window itself for people to use. And yes, I will be there to help you with a PCOS diet. But as I mentioned, it's more about changing the way you think about food and changing your habits rather than getting just a chart, because we want to really teach you what it means to eat right for you specifically. And this is why we have a program rather than just one meeting and slap you with a nutrition plan which you're going to follow for a while and then you're going to drop, and there's going to be no lasting effect. Yes.
So there are a lot of questions that I think we do not want to get into. I mean, I think you must see a gynecologist for these, or I mean, we do not want to get into medical advice via a video webinar, and that's something that we don't want to do. So I'm purposely not talking about those. There is, however, interest to know what are the kind of supplements that they can eat for, and what are some of the maybe the minerals and the vitamins that they must see before choosing a supplement.
Yeah.
Our Berkowitz Grow supplements, they are extremely effective for hair loss. They must look for biotin. They must look for zinc, and iron is also very important. Vitamin D, vitamin B12. These are some important, vitamins and minerals that they must look for. What are your views? I'm sure you will have a lot to add in this.
Yeah, I have quite a bit. Yeah, so as you mentioned, vitamin D. So let me touch on the common deficiencies that we see in Indian women, mostly vegetarians as well. So vitamin D, everybody's deficient. I can guarantee that 95% of the attendees of this webinar are deficient in vitamin D, myself included, and until I started taking supplements. And the reason for this is because vitamin D is a vitamin we get from exposing ourselves to the sun. No shortage of sun in India, but a shortage of going out. So and this is something that nutrition cannot take care of. And vitamin D is extremely important in many functions. There are some research that implicits it in managing blood sugar. There are some research, stronger research, implicing it in visceral fat accumulation. So the fat around the belly. This is the fat that we really want to get rid of because metabolically it has adverse effects on PCOS. And also for anxiety and depression, who people with hormonal imbalance, they have emotional imbalance sometimes, which vitamin D deficiency further increases. So we really want to take care of that. It's a simple pill you pop. So that's that. All the B group vitamins, biotin, B12, B3. Basically what happens, the hair follicle has stem cells in it, and those cells are extremely sensitive to different signals the body sends, right? Be it endocrine signals, both hormones, but it also signals of deficiencies. So if you have deficiencies in D vitamins, the follicle just dies, and this is why you have thinning of hair. And for people with PCOS who have the endocrine signal is not as strong, if you will, or is not as clear, if you will. So any adverse effects that you kind of accumulate on top of that, the fast renewing tissues are the tissues that are going to react, and hair follicles, hair grows fast. It's a fast renewing tissue. So this is why you suffer that, and also other symptoms like your bladder, the lining of your gut as well. With regards to iron deficiency, also a very common deficiency in India in general. And the hair fall is one of the symptoms of being iron deficient or anemic or both. For people who have chronic iron deficiencies that actually turn into anemia, or vitamin B deficiencies that turn into another kind of anemia, it could explain the fatigue. It would explain much more severe symptoms of the PCOS because it's stacked on top of the anemia. And this is something that we find a lot with our patients as well when they come to us with wanting to treat their PCOS, but then we test their blood and we see, oh, you actually have vitamin D deficiencies and anemia as well. Let's fix it. And then you can feel better in a much shorter time. And of course, like if you don't do this blood test, if you kind of avoid testing, then this is something that you're never going to find out and treat effectively.
Yep, I think we've covered most of, we've covered almost all the questions, and unless they're very specific or they're sort of in some way a repetition of what we've already talked about. So I think, yeah, I mean, maybe both of you, if you can share some closing thoughts, and then we can wrap the webinar up. It's been a good 1 hour, very informative for us, and I'm sure for the audience as well. So we have we have quite a few users on YouTube as well, and on Zoom as well. We had quite a good, I think
we had the full 100. I think
we had the full 100 register. We had the full 100 visitors. So yeah, just closing thoughts from the two of you.
Okay, so I just hope that everybody, takes this message home, that PCOS is not something which can be cured overnight or with a monthly treatment. It is a chronic concern, but it is not something which you have to live with, every single day of your life. Do not be scared if you have PCOS. You have very good solutions available, not just medicines, but also through lifestyle management. So, seek proper advice to get these suggestions so that you can incorporate them into your life and you get a very good holistic solution to your problems. You do not have a major disorder. Do not be scared of it. If you deal with it properly, you will not be concerned of these symptoms at all, because for every symptom we have a solution available.
Yeah. From my end is that people, I would agree with Anupia. People kind of accept this faith that they have, suffering from this disease. Or I'm going to look a certain way. I'm going to feel a certain way, and you might be very surprised how far very simple little changes in your daily routine go into making you much better, because what we find is that people do around 30 to 40 little choices around their nutrition and well-being in a day. And all of these little choices, they have cumulative effects, right? It's many little choices that come into one big condition, thing, feeling, symptom, whatever you want to call it. And if you fix even some of them, as Anupra mentioned, even if you lose 5% of your weight, there's already an improvement. If you start having breakfast at a fixed time, there's already an improvement. You start sleeping better, there's already an improvement. So there's so many different things each one of us can do that have this effect. So almost anyone can benefit from this. Almost any fan, like no cause is lost, no case is lost. This is something that I want you to take home message. This is definitely in your hands, and of course you can use us for it as well, to help you to change this and to live a normal life.
So everybody, this entire video will be available on YouTube. So you can go back to YouTube and check if you have, missed out on any point. You can even leave your comments below that video, and our team can take care of the questions. And as I always say after every video, stay healthy and stay beautiful. So you must remember to stay healthy. That's the most important.
Done.
All right. Thank you everyone for coming
Thank
and for being here for an hour to listen and to increase your knowledge. That's really great. Kudos to all of you. And it was lovely talking to you, Max. And it was a very informative session for me as well, because so many patients of mine, they ask me for such suggestions. Now, if I have any concern, I will definitely get in touch with you.
Please, I will do the same.
Okay.
Thank you very much, Anupriya, for having us.
Thank you, Max and Anupriya. Thanks. Bye-bye.
Bye. Bye, everyone.